Today, I will be talking about 5 things you should necessarily know before planning a pregnancy. Consider this as your very first step towards a healthier pregnancy. These 5 essential recommendations have often been overlooked, but actually, they form the foundation on which you build a mansion of your motherhood. Hi everyone, welcome back to my channel, Womb to Super Womb. I am Dr. Samata with you on this journey towards a healthier you. In my last video, I talked about preconceptional care, its importance, benefits, and why every woman needs it. Thank you for watching, liking, and responding positively on my last video. If you have missed, please find the link in the description below and do watch. Do not forget to share it with your near and dear ones who want a super womb for their super baby. Now, let's begin to converse in the language of your womb. For your understanding, we will divide the planning of pregnancy into 2 steps. Step 1 or early preconception planning. This should start 1 year to at least 6 months before conception. And step 2 or late preconception planning, which should start roughly 3 months before conception. In this video, I will be talking about 5 recommendations in step 1 or early preconceptional planning. Please note that the effects of these 5 recommendations cannot be achieved over a short period of time. So, it should be started well in advance so that the good effects of those start acting on your body and your prospective baby right from the day 1 of conception, and the benefits of which will be surely reaped by your family. Recommendation 1: Basic health checkup. If you're serious about planning a pregnancy, I advise you to go to your physician for your first regular, basic, and a few advanced health checkup just to rule out a few conditions like high blood pressure, diabetes, sexually transmitted diseases, or level of your thyroid hormones and hemoglobin, or other chronic diseases, if any. Ideally, this should be done 1 year to 6 months before you plan to conceive. Health checkups during this timeline gives you enough time to sort out these issues in the coming months leading up to your pregnancy. The next 4 recommendations are behavioral and lifestyle modifications. They certainly take a long time to show good effects, but will surely help you in the long run. Recommendation 2: Diet. We all know about the food pyramid system of carbs, proteins, and fats, and why they are important. So, let me not repeat all of that in my video. Let us talk about diet, which is essential for a woman before conception and during pregnancy. The objective here is to create a depot of macro and micronutrients in your body to create a healthy atmosphere for yourself and to support a new life. As a woman is more likely to develop a deficiency of iron, folic acid, and calcium in pregnancy, she needs to add these to her diet so that she will not enter pregnancy in a state of deficiency. Iron and folic acids are needed for formation of blood. Folic acid is specially required for development of brain and spinal cord, which prevent neural tube defects in the baby. And calcium helps development of bones, helps circulation of blood and muscular activity. Dark green leafy vegetables such as spinach, dry fruits such as raisins, dates and apricots are rich sources of iron, while broccoli, Brussels sprouts spinach, and kale are rich in folates. Milk and cheese are good sources of calcium. Drink at least 1 glass of milk per day if your body is congenial to milk and milk products. Then, drink at least 8 to 10 glasses of water per day, as this is not only essential for functioning of each and every organ in your body, but also to throw out all the toxins from the body. Recommendation 3. Healthy weight and exercise. A healthy weight is of immense importance before conception. During pregnancy, a woman may gain around 10 to 12 kilos of weight. This additional load can negatively impact on the mother's heart and may also increase the risk of high blood pressure and diabetes during pregnancy. Hence, it is very important for a woman planning a baby to keep her body mass index between 19 and 25 kg per meter square. For an underweight or overweight woman, it may take a long time to gain or lose those additional pounds. Hence, the necessity of an early preconceptional care. During pregnancy, the additional weight causes an undue stress over the back, pelvic floor, and abdomen. It becomes very difficult for a woman to start exercising once she is in this state. Hence, it is advisable to start exercising early to target strengthening abdominal, back, and pelvic floor muscles like Kegel's exercise and asanas. While breathing techniques like pranayama energize you and reduce your stress levels. Recommendation 4. Sleep. A sound 8 hours of sleep at night works wonders in the body when it comes to secretion of female sex hormones like estrogen and progesterone. Lack of sleep may cause an imbalance in the female sex hormones, and vice versa is also true. Since this is a vicious cycle, it is advisable to break this loop long before it gets out of hand. Lack of sleep has been found to be one of the major reasons for problems in conception. Researchers have shown that lack of sleep can increase the risk of infertility by 4 times. So, by improving your sleep quality and pattern, you can increase the chances of conception whenever it is planned. Recommendation 5. Quit smoking. When it comes to planning a pregnancy and during pregnancy, smoking should be completely stopped, as nicotine present in cigarettes can cause your blood vessels to narrow and create problems in your baby's growth and development. Researchers have shown that the damage caused by smoking cigarettes lasts for decades even after you quit smoking. So make sure you quit smoking at least a year before you plan to conceive. The earlier you start inculcating these 5 recommendations in your routine, the better it gets for planning a healthier pregnancy. In my next video, I will be talking about painful periods and how to know if your pain is normal or not. Please do not forget to subscribe, like, share, and comment. Stay healthy and stay tuned. Thank you.